Most people check their blood pressure, they check their cholesterol, they even check their blood sugar. But almost nobody checks something that can reveal early cardiac trouble months before a single symptom shows up anywhere else in the body: their own fingernails. If you're over 60, your nails are doing more than growing. They're acting like a window into your circulatory system, recording subtle changes in blood flow, oxygen delivery, and even infection inside your heart valves. And 3 specific patterns: a rounding of the fingertip, faint horizontal grooves across the nail, and tiny reddish-brown streaks that look like wood splinters, are signs cardiologists are trained to look for, and signs most people walk around with for months without ever connecting them to their heart. Today, I'm going to walk you through exactly what each of these 3 signs looks like, why your heart and your nails are connected at all, when a nail change is something to simply mention at your next checkup versus something to bring up right away, and which specific tests to ask your doctor about if you notice any of them. To understand why your fingernails would have anything to do with your heart, you have to understand what a nail actually is. A nail isn't just a flat plate of keratin sitting on top of your finger. Underneath it is a dense bed of tiny blood vessels called capillaries, and at the base of the nail sits the nail matrix, the living tissue that produces new nail material every single day. Think of your nail bed as a small garden, and the capillaries feeding it as the irrigation system. As long as that irrigation system delivers a steady, well-oxygenated supply of blood, the nail matrix keeps producing nail material in a smooth, consistent pattern. The nail grows out flat, pink, and uniform. But your heart is the pump that keeps that irrigation system running. When the heart struggles to pump efficiently, when oxygen levels in the blood drop, or when something is going wrong inside the heart valves themselves, that irrigation system at the very tip of your fingers is often one of the first places to show the strain. It's far from the heart, it's richly supplied with small vessels, and it's visible without any equipment at all. So the question becomes, can your nails actually tell you something useful about what's happening inside your chest? For 3 specific patterns, the answer from cardiology research is yes. Let's start with the mechanism behind digital clubbing, the most studied of the 3 signs. Under normal conditions, your blood carries oxygen efficiently from your lungs to every tissue in your body, including the tips of your fingers. But when a chronic heart condition, particularly congenital heart defects, infective endocarditis, or long-standing heart failure, reduces how much oxygen reaches your bloodstream, your body responds by trying to compensate. One way it compensates involves a molecule called vascular endothelial growth factor, or VEGF for short. Normally, your lungs filter out and break down megakaryocytes, large cells that produce platelets, before they ever reach your fingertips. But when blood bypasses that normal lung filtering, as can happen with certain heart conditions, fragments of these megakaryocytes lodge in the tiny vessels at your fingertips and release VEGF directly into that tissue. Think of VEGF as a construction crew that builds new blood vessels. In a healthy lung, that crew never gets deployed to your fingertips because the megakaryocytes are broken down before they get there. But when the heart's plumbing allows them to slip through, the construction crew shows up exactly where it shouldn't, triggering new vessel growth and soft tissue swelling at the fingertip. Over weeks to months, that extra tissue growth is what produces the rounded, bulbous shape associated with clubbing. A study published in the journal Heart followed patients with cyanotic congenital heart disease, heart defects that reduce blood oxygen levels, and found that the degree of nail clubbing tracked closely with how low patients' oxygen saturation measured, with more pronounced clubbing appearing in patients whose oxygen saturation sat below 85%, compared with a normal range of 95% to 100%. Bow's lines work through a completely different mechanism. These are horizontal grooves that form when the nail matrix, that living tissue factory at the base of your nail, temporarily slows or stops producing new nail material. Think of the nail matrix like an assembly line in a factory. Under normal conditions, it runs at a steady pace day after day. But a major physiological stress, a heart attack, a severe infection, a sudden drop in blood pressure can shut that assembly line down for several days at a time. When production resumes, a visible groove marks the spot where the line paused, and that groove travels slowly down the nail as it grows, taking roughly 3 to 6 months to reach the fingertip on a typical fingernail. Splinter hemorrhages involve yet another mechanism: tiny traveling clots. The capillaries under your nail run in narrow, straight lines, oriented from the base of the nail toward the tip. When small clots or bits of bacterial debris, called emboli, break loose from infected material on a heart valve and travel through the bloodstream, some of them lodge in these narrow capillaries. Because the vessels are so straight and narrow, the resulting tiny hemorrhage doesn't pool into a round bruise. It stretches into a thin line, mimicking a splinter caught under the nail. An analysis of patients with infective endocarditis, a serious infection of the heart's inner lining and valves, found that splinter hemorrhages appeared in roughly 15% of confirmed cases, making them a recognized, if not universal, physical finding that cardiologists are trained to look for during a physical exam. So 3 different mechanisms: oxygen-driven tissue growth, an interrupted production line, and traveling microclots, all converge on the same visible canvas: your fingernails. Now let's go through exactly what each one looks like and what to do if you spot one. The first sign to know is nail clubbing. Healthy nails sit at roughly a 160-degree angle where the nail meets the skin at its base, with a slight visible indentation where the cuticle begins. With clubbing, that angle increases past 180 degrees, and the nail bed can feel spongy when you press on it. The fingertip itself often appears wider and rounder, sometimes described as looking like an upside-down spoon or the rounded end of a drumstick. There's a simple way to check for this at home, called the Shamroth window test. Place the nails of 2 corresponding fingers, say, both index fingers, back to back, so the nail surfaces touch. In a normal nail, this creates a small, diamond-shaped window of light between the 2 nail beds. With clubbing, that window disappears, because the increased curvature of the nails causes them to touch along their entire length instead. Clubbing rarely develops from a single short-term illness. It typically builds gradually, over months, and it's most associated with long-standing reductions in blood oxygen, conditions like congenital heart defects, certain types of heart valve disease, and chronic lung disease that also strains the heart. If you notice this pattern developing, particularly if it's new and progressive, rather than something you recall having for years, it's worth mentioning to your doctor rather than dismissing it as just an unusual nail shape. The second sign is Bow's lines. These appear as a single, visible horizontal groove running straight across the width of the nail plate, as though a tiny ridge has been pressed into the surface. Unlike vertical ridges, which are common with normal aging and are rarely a concern, Bow's lines run perpendicular to the direction of nail growth, and you can usually feel a faint indentation if you run a fingertip across the nail. Because the average fingernail grows at roughly 1/10 of a millimeter per day, a Bow's line near the base of the nail tells you the stress event happened recently, while a line further up toward the tip tells you it happened months earlier. If you find a single Bow's line and you recently recovered from a major illness, surgery, or a documented heart event, that lines up with what's already known. But if a Bow's line shows up with no obvious explanation at all, that's the version worth bringing up at your next appointment, because it can be one of the only visible clues that a silent cardiac event, like a small heart attack that never produced classic chest pain, took place. The third sign is splinter hemorrhages. These look exactly like their name suggests. Thin, reddish-brown to almost black lines running vertically under the nail, usually somewhere in the middle third of the nail bed, resembling a tiny wood splinter lodged just beneath the surface. They're typically 1 to 3 millimeters long, and they don't move or fade when you press on them, which helps distinguish them from an ordinary bruise. A single splinter hemorrhage, especially one sitting near the free edge of the nail, often comes from minor trauma, a stubbed finger, a tight glove, vigorous typing, and usually isn't something to worry about. But multiple splinter hemorrhages appearing at once across more than one nail, especially alongside unexplained fever, fatigue, or a new heart murmur, paints a different picture entirely. That combination is one of the classic physical findings doctors look for when investigating infective endocarditis, a serious heart valve infection that requires prompt treatment. So, to put the three signs together, clubbing tends to build slowly and points toward chronic oxygen problems tied to the heart and lungs. Bow's lines appear as a single horizontal marker and point toward a major physiological stress event, sometimes cardiac, that already happened and has since passed. And splinter hemorrhages, particularly when they show up in clusters, point toward an active process that may still be unfolding inside the heart valves. None of the three on its own confirms a heart condition, but each one is a reasonable signal to get a proper evaluation rather than waiting to see if it simply goes away on its own. Now let's talk about a few mistakes people commonly make when it comes to reading these signs, because getting this wrong in either direction, ignoring something real or panicking over something harmless, doesn't serve you well. The first mistake is confusing these signs with far more common, far less serious nail conditions. Fungal nail infections can thicken and discolor nails in ways that superficially resemble clubbing. Psoriasis can produce pitting, ridging, and discoloration that can be mistaken for Bow's lines. The fix is straightforward. Don't try to diagnose yourself from a single glance. A doctor or dermatologist can examine the nail directly and, if needed, order simple tests to tell these conditions apart in a single visit. The second mistake is assuming clubbing must be a lifelong family trait without actually checking. A small percentage of people are born with a nail shape that resembles mild clubbing and have had it their entire lives without any underlying heart or lung issue. The fix here is comparison. Look back at old photographs of your hands from 5 or 10 years ago if you have them, or simply ask whether anyone in your life has noticed a change. New and progressive is a very different finding than always been this way. The third mistake is treating every splinter hemorrhage as a heart emergency, when a single one is usually explained by everyday trauma. The fix is to look at the whole picture rather than one nail in isolation. Are there multiple hemorrhages across more than one finger? Is there an unexplained fever or unusual fatigue alongside it? Context turns an isolated curiosity into a finding worth calling your doctor about. The fourth mistake is checking nails under poor conditions, dim indoor lighting with polish still on, or right after washing dishes when fingers are swollen and pink. The fix is simple. Check bare nails in natural daylight or under a bright white light, and give your hands a few minutes to return to their resting state first. A nail sign that's subtle under fluorescent light at night can be obvious in daylight the next morning. If you do notice one of these signs and decide to bring it to your doctor's attention, here's roughly what to expect along the way. On the day of your appointment, a pulse oximetry reading, the small clip-on sensor that measures your blood oxygen level, takes seconds and gives an immediate first clue about whether clubbing could be related to oxygen levels. An electrocardiogram, commonly called an EKG, can usually be done in the office the same day and gives a same-day readout of your heart's electrical activity. If basic blood work is ordered, routine results like a complete blood count or inflammation markers typically come back within 1 to 3 days. If your doctor suspects something like endocarditis and orders blood cultures, those generally take 24 to 72 hours to grow and confirm or rule out a bacterial cause, though treatment can begin sooner if the suspicion is strong. An echocardiogram, an ultrasound of the heart that can directly visualize the valves, is often scheduled within 1 to 2 weeks for a non-urgent referral. And if an underlying issue is identified and treated, the nail itself doesn't reset overnight. Because of how slowly nails grow, it typically takes 3 to 6 months of healthy growth for a Bowes line to fully grow out, and for clubbing tied to a now corrected oxygen problem to gradually soften, though the timeline varies from person to person. Here are a few practical habits that make all of this easier to monitor going forward. First, make the Shamroth window test part of a monthly routine rather than a one-time check. Press the nails of both index fingers back to back, look for the small diamond of light, and take a quick photo with your phone on the same day each month. A photo log makes subtle, gradual changes far easier to spot than memory alone. Second, when you do bring a nail change to your doctor, describe it with specifics rather than generalities. Instead of saying your nail looks weird, say where the Bowes line sits relative to the cuticle, how many splinter hemorrhages you're seeing and on which fingers, or how long the rounding at the fingertip has been present. Specific details help a doctor decide quickly whether this needs urgent follow-up or can be monitored. Third, know which tests to actually ask for by name if a doctor seems uncertain whether to investigate further. Pulse oximetry to check oxygen saturation, a complete blood count, and inflammatory markers such as CRP or ESR to check for infection or inflammation. Blood cultures if endocarditis is a concern, and an echocardiogram to directly examine the heart's valves and chambers. Having these names ready saves time and makes sure nothing important gets overlooked. Fourth, always report the constellation, not just the isolated finding. A doctor evaluating one splinter hemorrhage alone has very little to work with. A doctor hearing about splinter hemorrhages plus a week of low-grade fever and unusual tiredness has a much clearer picture and can act on it appropriately. Fifth, pair any nail observation with basic vital tracking at home if you already monitor your blood pressure or oxygen level with a home pulse oximeter. A nail change that coincides with a drop in your typical oxygen readings carries more weight and gives your doctor a fuller, more useful picture than the nail finding by itself. At its core, this comes down to one simple mechanism. Your nails are nourished by some of the smallest blood vessels in your entire body, and your heart is the pump behind all of them, which means changes in how your heart performs can show up at your fingertips before they show up anywhere else. The actionable takeaway is just as simple. Once a month, in good light, take 30 seconds to actually look at your nails, not for cosmetic reasons, but as a quick, free, at-home check on your circulatory health. And if you do spot clubbing, a Bowes line, or a cluster of splinter hemorrhages, you now know exactly what it might mean, what questions to ask, and which tests can give you real answers. That's a level of awareness that puts you back in control of your own heart health, one small, honest look at a time.